Welcome to Talk with Maria. Today we'll be talking about the importance of foot care with Dr. Miles Grossman. Dr. Grossman, thank you so much for joining us
Oh, you're
today.
very welcome. Thanks for having me.
We have seen a lot of feet through your expertise.
Yes.
Tell us a little bit about you. What made you, there's so many different things that you could have been. What made you want to become a podiatrist?
In my family growing up, we only had three professions. You were either a doctor, a lawyer, or a rabbi. And right off the bat, I knew rabbi, not for me. Lawyer, too much reading, not good.
Right?
All
Two
right,
strikes.
I'll be a doctor.
What led you? How did you travel down that path of being a podiatrist?
I went to college and I got a bachelor's in biology at Stony Brook. Had no idea what I was going to be doing with my life. My father was concerned,
Like every father would be.
spoke to my older brother, who was a doctor, and said, we have to do something with him. What's he going to do? He introduced me to a doctor at Downstate Medical School where he went to
the good
school.
old downstate.
And he kind of led me down the road to becoming a physician. I went to Hofstra
Nice.
for my master's degree in
Very good.
biology,
Kudos to Hofstra.
planning on going to medical school.
Right.
I was in synagogue one Saturday. Services were over and I was talking to a podiatrist. And I said to him, so what exactly do you do for a living?
Right.
And he says, well, why don't you come to my office and see? He had a waiting room filled with people, had multiple treatment rooms and an operatory, and he went from room to room to room to room to room, and he was doing this and doing that. He sat me down when everybody was all gone, and he said, Miles, it's the greatest profession in the whole wide world. You have to do this. As a matter of fact, you'll graduate, you'll come to work with me, I'll retire, it could be all yours.
Golden spoon.
And I said, that's what I'm gonna do.
That was amazing.
And I went home and I said to my dad, I said, Dad, I'm not going to medical school. And the man's face went, what do you mean you're not going to medical school? I said, don't worry, I'm going to go to podiatry school instead. He goes, oh, that's okay.
And that makes me
That'll
happy.
work.
Yes.
That'll work.
Really nice.
The two doctors that trained me hired me to work with them the following year. One of them and I decided that we were going to collaborate and open up a practice in Merrick together.
Yes.
In 1988, he and I parted ways and I bought him out. In 1997, I was talking to my mom one morning on a Sunday and she said, oh, I was just on the phone with Al, and that was the doctor who was my inspiration.
Nice.
And said that, he said that he was looking to sell his practice.
Wow.
And I went, Ma, I'll call you right back. Called him up, we spoke. I bought the practice in Westbury from him, and I have a partner, Dr. Joseph Gervasio.
Yes, Dr. Joseph's really good too.
Best partner in the whole wide world.
Yes.
It's great.
Listen.
And we've never had a fight.
Oh my God, are you
The
kidding me?
perfect marriage.
Let me tell you something, but you're a great man to get along with as well. And I can see you having a wonderful, and he's a great doctor too. Made in heaven, match made in heaven. How perfect your life has been, Doc.
Perfect, I don't know, but it's had its ups and downs.
Right? Like everything
Right.
else. People just kind of discount their feet after a while. They're like, I just got my feet, until it starts paining for one reason or the other. And we're certainly going to go into all the things, all the quirks of feet. You have probably seen all different types of feet, all different type of foot problems. And of course, your heart and soul is in care. So, it's like somebody starts walking in your office and you know exactly what's going on.
One of the very first things that we're going to do is take an extensive history of their health. I want to know, did they have any heart problems, liver problems, kidney issues, diabetes, rheumatoid arthritis, all these issues have systemic manifestations and affect your whole entire body. And signs that we can find in the foot can help relate to discovering problems that nobody even knew that they even had.
Dr. Grossman, I am so excited to have you in our set today.
I'm thrilled to be here.
Yes.
Thank you.
Stay tuned as we continue with Dr. Miles Grossman, podiatrist. Welcome back to Talk with Maria. We're talking about the importance of foot care with Dr. Miles Grossman today. Dr. Grossman, tell us a little bit about some of the common foot problems that you've seen and treated.
Well, probably the most common are big, thick nails, bunions, hammer toes, warts. Those are pretty much what we see mostly. People will come in, it's an obvious thing. My foot hurts, I get a pain when I'm standing, I can't wear shoes, it's killing me.
And this is mostly men or women, or combination?
It's a both. Mostly we see it in women because women have to wear women's shoes. Men get to wear men's shoes, which are always cut bigger and wider and a lot more roomier. And oftentimes men kind of have the ability to wear work boots or sneakers more, and so it's a little bit more comfortable for them.
Wow.
To wear, as opposed to a woman who has to wear a 3-inch high heel shoe or higher for that matter, with a real narrow pointy toe.
How does the coordination of someone deciding out of the Stone Age, instead of just wearing flat sandals, I'm going to elevate the back of a woman by using 3 inches or maybe 5 inches?
He was the original podiatrist that God
It
created.
had to be. It just had to be. I mean, and then he gave you all this work.
Right.
Yes.
God needed for me to have a profession.
Listen, and a profession you certainly had. So you come in with all of these problems, and how do you tie them into the whole systemic value of?
Well, there are certain disorders such as diabetes.
Right.
Diabetes is a systemic disease. It affects the entire body. It affects every organ in the entire body. The circulatory system, the nervous system, for example. The longer a person ages, the worse their diabetes will affect them.
Wow.
The circulation will become less and less and less. So it takes time for the blood to circulate from the heart, which is rich in oxygenated blood, to go all the way down to the foot. And as it's going through its travels, it's giving nutrition to all different areas. When it gets down to the foot, there's very little oxygen left.
Right.
So it gets the least amount of nutrition as opposed to other areas.
And so with nurses and doctors and all the essential workers that we play into in the profession of care, how many doctors and nurses come with their feet aching?
I have a very large contingency of nurses that come to see me, especially ones that working not only like in a hospital setting or in an OR, but also in a home health facility.
Right.
Or in like nursing homes and assisted living complexes, because they're on their feet all day long.
It's very sad.
Yes, and my door is always open, and as soon as they call, if they have to wait a day, that's a lot, because I usually tend to say, come now. Just
you already
come right
know.
now. I'm here, I'm not going anywhere.
Wow. You do your profession with such, I don't want to say job, with such sweetness, with such love. I just love that about you.
You know, I treat every single patient as if they're my family.
I totally agree with that, and I can vouch for that.
And I treat everybody like they're my mother or they're my father. And if I wouldn't treat my mother or father that way, I wouldn't do it to you.
I totally agree. And you've totally demonstrated that. One of the nicest things about your profession is that you are one of the very few doctors that do home visits with seniors.
When I was doing my training, one of the doctors that I was working for said to me, I have this group home. Would you like to go and go there and take care of them? You could go on,
A lot of good
on your
vibes.
leisure,
Yes.
and you could see them all, and you can bill it out on your own. You can make some extra money outside of the big $200 a week that I was getting at that time.
Wow.
I just got such a great feeling
Yes.
doing something extra nice for people that just don't have the ability to do it themselves, number one.
Yes.
And number two, the ability to go out and get it done is not so easy. And it started with them. That group led to, I was watching News 12 one day, and
News 12.
did a story about a group home in Syosset. And I went, wow, that's like only a couple of blocks away from where I grew up. So I went over there and I introduced myself and I told them who I am, and I asked them if they had a podiatrist that came, and they said, no, we don't. I said, well, I would love to. And one led to another, and then another, and another, and another, and I was doing multiple.
Right.
Now, unfortunately, for me, I don't do group homes anymore in their own homes, but some still come to see me in my office. But house calls I've done ever since I started practice, and I still do it today.
Yes.
And we'll continue to do that as well.
And I have to tell you, every single person that is called a senior loves Dr. Grossman. They love his smile, they love his attention, they love his care, and of course, they feel so much better when he visits their home.
Not only that, but now it's the winter.
Yes.
And with the winter brings ice and snow.
Right.
And I'll tell all my patients that come to see me, listen, we're going to see you back in a month. If the weather is bad,
Right.
don't come. You call me.
Yes.
We'll come to you.
That is so kind of you. We have to take a quick break. We'll return. We'll hear more from Dr. Miles Grossman, all about feet. Welcome back. Today we're with Dr. Miles Grossman, and we're going to talk about maintaining healthy feet and all the different signs of unhealthy feet. Dr. Grossman, tell me, someone's walking into your office and you're looking at them. What's the first signs what's going through your head?
Well, the first thing that we're going to do, obviously, after we take a complete history of their medical issues, what medicines they're taking, and so on and so forth, is there going to be an examination where we're going to physically look. We're going to look at all the nails in between the toes, the bottom, the top, look for any kind of thickening of skin or hardness, and then key into their own particular issues and complaints. What's bothering you? Where does it hurt? When does it hurt? How often does it hurt? What makes it feel better? What makes it feel worse? And then kind of zone in as to what.
Tell me how diabetes plays into foot care.
Diabetes, as I said before, is a systemic disease, and it can affect all the organs in the body. If a person is a diabetic and they come into the office, we want to be very proactive. We want to create a situation where we don't want a problem to happen and then treat them.
Great.
The biggest problem with diabetics is that little minor problems that you or someone else who's not a diabetic might have can manifest into a major catastrophe in the blink of an eye.
Wow. Yes.
And that's what we don't want to have.
Is there foot cancer?
Yes, there is. You can get the skin cancers in the skin and also in the nail.
Let's
You
talk about
could
the
find
nail.
it.
So you would make a recommendation for further treatment.
I will only treat a patient with my best ability. But if I know that I can get them someplace else where they could take care of it better than me, then I will refer them to either another doctor, an orthopedist, another podiatrist that might be more skilled than me.
How do you feel like there might be something going on in your feet that needs further care?
Well, if you're gonna examine the foot and you're gonna look at it and you're going to see anomalies, moles, for example, like any other kind of skin cancer, you could do a punch biopsy, send it out, have it analyzed, and then come back, and when the results come in, if it's, God forbid, comes back positive for cancer, we would send out the recommendation. Or I might just say, you know what, this just does not look right.
Right.
And I don't want to putz around with it and waste everybody's time. I think you
Right.
need to go to an oncologist right away.
And of course, you want to ensure that you're not being scared because it might be something, it might be nothing. But at the same time, don't ignore your feet is the message today. So I want to get back to nail salons.
My best source of customers.
There's a flow of stuff that happens in a nail salon because everybody's feet. I know the Department of Health made a very warning factor that they should not use the bowl that they're using to just clean and scrub because, like a whirlpool, things get caught up in the lines, and so every basin should have a new plastic liner.
Now, in my office, we will routinely give whirlpools to patients. It's kind of a lost art. To me, I think it's a wonderful thing. And
It
if you use,
is.
it just helps to relax the
Circulate,
patient.
yes.
It makes the skin softer. It makes the nails easier to cut. It just makes for a nicer interaction between patient and doctor. But at the same time, after every use, it's completely scrubbed down, it's disinfected before the next person goes in to use it.
Right. How do you treat? There's been a lot of nails. I have a friend of mine that has gone to a nail salon and all his fingers has turned black and they just started falling off. Toenails turning black, just having a fungal affection in there.
Fungal nails is probably the most common thing that we sit and treat all day long.
Really?
Very difficult. It's not easy. It's basically athlete's foot, which people get all the time on their skin, where it'll get peeling, red dots, itchy. On the skin, it's easy. We write a prescription for an antifungal cream. You put it on a couple times a day. It takes a couple of weeks for it to finally go away, and you're great. And then we'll tell you what to do to help prevent it from coming back so quickly. Make sure you dry your feet all the time when you come out of the shower. Don't have wet feet
What about
into
sweaty
socks.
feet? The people that just
Well,
sweat
that's
their
a big
feet.
that's a big cause of it, because
Right.
fungus requires darkness, moisture, and heat in order for it to grow. So if we take a foot and we put it in a sock and we put it in a shoe, you got darkness. When you're walking around and you're running around, especially in the summertime, you got heat. So you can't control the darkness and you can't control the heat, but you control the wetness. That'll help to prevent it from coming, because it needs all three.
It dawned on me prior to our conversation, when you go to the nail salon and they take that same polish and dips from one toe to the other.
Well, that's the biggest thing that I always stress to my patients, is that I don't have a problem if you want to go to the nail salon, but come to see me first.
Right.
Let me do all the meat and potatoes, so to speak.
Yes.
I'll cut your nails. I'll take away all the calluses off of the bottom of your foot. I'll make it all nice and smooth. Now, if you want to go, because all of my instruments are all sterilized, they come out of a clear, clean pack that I'm opening up right in front of you. And then, when you're all done, now you can go to the salon and just say, just polish. I want to make it look nice. And if you want to file it, okay. But I want you to take a brand new emery board that you never used before. And the color of the polish that I'm going to pick out, I want to make sure it's never been opened before, because oftentimes the polish will be open and that brush is used to apply the polish to somebody else, and then it goes back into the bottle, closed up, put down on the table or back up on the shelf for somebody else. Especially like the pre-coat, the after coat, and all the other coats that they put on you.
It's like polishing a car. We'll take a quick break, come right back as we hear more from Dr. Miles Grossman on feet. Welcome back to Talk with Maria. We're talking about the importance of foot care with Dr. Miles Grossman. So tell us a little bit about, I bumped my feet into the bedpost.
The famous,
Yes, the little toe syndrome.
that poor little baby toe.
Oh my God.
The biggest misnomer is, oh, it's just a broken toe. It's nothing. And I'm going to forget about it. Well, not true. So we'll have patients will come in, we'll x-ray it, depending upon the severity of the break. How many pieces is the bone in?
Wow.
Is the bone in proper alignment? If it's not in proper alignment, it's not going to heal right. If it doesn't heal right, you're not going to be able to have the function and the mobility in that toe that you used to have beforehand. Fractures, which is what a broken toe or a break is, and nobody says, oh, it's not broken, it's just fractured. I hear that all the time.
Right.
Well, that's the same thing.
Yes.
If it's broken, it's fractured. If it's fractured, it's broken. So we want to immobilize the area that's broken so that this way it can heal. Broken bones can mend as long as they're put and made stable and not moving, and if the alignment is correct. It takes time. Generally, it's 6 to 8 weeks in an adult, 4 to 6 weeks with a child, but you have to have patience. And
gotta have patience.
there are times, and in certain parts of the foot, like the bottom of the fifth metatarsal bone, people could be walking and they could trip on a curb and twist their ankle. And there's a muscle on the side of your leg called the peroneal muscle that has a tendon that attaches right there on the side of your foot, which attaches to the base of that fifth metatarsal. And it could pull when your ankle gives a quick jerk, and it could actually pull the base of that fifth metatarsal and break it.
Oh my gosh.
And oftentimes that is a problem that can be dealt with conservatively, but sometimes it does require surgical repair.
So I'm walking and I'm feeling a pain in the back of my heel. How do you treat that?
The back or the bottom.
Ah.
And when is this happening? The classic story is I wake up in the morning and I get out of bed and oh my God, it's killing me. I walk like my great-grandmother till I get to the bathroom and I'm hobbling. And that's like the classic story of a heel spur. Or people say my arch is killing me, which is a condition usually known as plantar fasciitis. And fasciitis and heel spurs are kind of combined. They kind of like go hand in hand. Yes. Yes. So we treat both at the same time together.
I see. What would you advise people not to do?
Let the doctor be the doctor.
Right.
There's nothing wrong with reading on the internet. There's so many things that all look the same and can be the same, but they're all totally different.
Right.
And you don't want to treat a wart if you have a callus, because they look the same.
Right.
They appear in the same places, but they're two totally different problems and need to be treated two totally different ways.
Tell us where your offices are located.
My main office is in Merrick at 2174 Hewlett Avenue. And my other office is right on Post Avenue, right up the block from you. If I can't help you, I'll be able to direct you to the best possible place for you where you can get the help that you need and deserve to get.
Thank you so much, Doc. Thank you so much for joining me on the Talk with Maria show today. I hope you found our conversations informative and inspiring. Visit our website, talkwithmaria.com, for resources and information. Share your thoughts on social media with hashtag #TalkWithMaria, and tune in next time for more inspiring discussions. Until next time, stay curious and keep exploring. Talk with Maria is made possible by, if you're passionate about helping others, become a certified home health aide with Home Health Aide Training Institute, 516-333-3689, or visit hhati.com. Experience the authentic taste of Italy in the heart of Westbury. Rialto Restaurant. Make your reservation at 516-997-5689. Brooklyn Boulevard Home Care. They care for you in the comfort of your own home. To schedule your care, call 718-683-8303.